All right, we're talking about protecting those out there on the front lines and not necessarily those specifically within the health industry. Joining me to talk about this is Josh Feinberg, Chief Strategy Officer of ABM Industries, as well as the President of the Cleaning Coalition of America. Josh, thanks for taking the time.
Thanks, Mike. I appreciate you having me.
Of course, we're talking about cleaning service professionals, grocery stores, airports, public transportation. I mean, I don't want to say that we forget about them, but these are workers who kind of get lost in the mix here, would you say?
Oh, absolutely. In fact, we often use the word forget. Unsung heroes, people who are invisible, out of sight, out of mind. Keep in mind that pre-COVID, pre this experience, most of our cleaners cleaned at night. You might see the janitor come by your office at 6 p.m., but you really wouldn't see them much. And we did an exorbitant amount of cleaning at night. Now, with what's going on and the need to disinfect all the places and spaces we all want to go, it's become as essential as anything else. And you know what we say? We like to say they're the gatekeepers of the other essential workers, because we wouldn't be able to be in hospitals today, in the grocery stores today, anywhere, without the cleaners.
All right, let's get to the main question here, Josh. Are these workers getting the protection that they need during this pandemic?
Well, what's interesting is right now the answer is yes. I would say firmly the answer is yes. Here's the catch. The catch is only 5% of America is out and about, right? We have stay-at-home orders across the country. We have stay-at-home orders in the Bay Area. I mean, everywhere. And so right now, because of the limited number of buildings that are open, these individuals are prepared. And we will not put anybody on the front line, anybody out there to clean without the right PP&E equipment, standard operating practices, all with guidance that is formed by the CDC, et cetera. So I worry more about when we start to open up again, not so much now.
Okay. I was reading that your organization was writing letters to Congress, writing letters to the White House, trying to get them to step up even more for the cleaning service professionals. Can you dive into that a little bit?
Yeah, and it hits exactly with your point on making sure that they're well supplied and they have the protective equipment they need. We are writing a letter. We'll have it out to Congress this week. We've had a number of conversations already with leadership on the federal side, even on the state side as well. And that really centers on two things. One is we need to keep these folks safe. We need to make sure that the supplies are prioritized for them. So right now, most supplies are prioritized with the healthcare workers as they should be, and the first responders as they should be. We need to be the next ones that are prioritized, because what is going to happen is there's going to be a huge demand surge for cleaning, as you can imagine, disinfectant, all the things we don't think about. But some of these supplies that are going to end up being scarce, we need to make sure that these workers have what supplies they need. They have the masks, they have the gloves, et cetera. So that's number one, is really prioritizing supplies for us. The other one is to make sure we get funding for payroll. We want to keep these folks employed. I know we've read a lot about it with aviation and some of the aviation workers, et cetera, some of the healthcare too. We cannot forget the cleaners. I mean, these are individuals that, there are over 1 million within our association across the country. And every day, as doors are closed, they start to shrink and shrink and shrink. We cannot have that. We need help in funding in order to keep them employed. So really, it's the safety and the employment is what we're looking for.
When you're talking about the funding, you look at, Congress is debating another stimulus package right now for small businesses, for hospitals as well. It's your belief that these workers are entitled and should get a good chunk of that, maybe not that particular package, but money down the road for what they're doing here?
Absolutely. I mean, number one is, and you hear this banted around a lot, and people will call it a hero fund or hazard pay and that sort of thing. These folks do deserve pay. I mean, they deserve extra pay for what they're doing, number one. Number two is we have to make sure we keep the jobs. We have to make sure we keep them employed in that network of professionals. These are skilled workers. These are individuals that are going to reopen the economy. The minute that we let those jobs go away simply because a customer or a building shuts down, the Golden State Warriors aren't playing right now. Well, I mean, they're not going to be using cleaners. Right. So what do we do with that as an example? We need to make sure that those folks are employed. So the minute that we want to start back up, 1 day before, 2 days before, they can go in, they can disinfect, et cetera. But they have to be kept at the ready, like we say. We cannot let them go.
As we move forward in this, and maybe it's not weeks or months down the road when states start to reopen, when those high rises start to reopen and allow workers to come in, do you think there's going to be, life's going to be different, right? So I know our work is going to be different. Maybe our desks are wider apart. Maybe we do have more cleaning, done throughout the day, not just at night. Are you guys prepared for that? Are there enough people, I guess, in the industry to do what's going to have to be done in the future?
It's a great point, and that's what we're mostly worried about. We're worried about, again, as I mentioned, the two issues we're mostly focused on. One is keeping individuals employed, and two, so we have to keep the requisite number of cleaners out there in order to fulfill the demand. Number two is keeping them well equipped, making sure they have the equipment and have the supplies. You can imagine pre-COVID, is one level of demand. Post-COVID, we're expecting a 20 to 30% increase in the demand because when you walk into the building, you're going to want to see a cleaner. You're going to want to be reassured that that place has been cleaned. You're going to want to see, individuals who are spaced out in the elevators, cleaning the elevator buttons. You're going to want to see things that you just never saw before. And so we're anticipating a pretty significant demand, which gets back to let's make sure we keep these folks employed, and let's make sure we're giving them the supplies and getting the supplies to them that they need in order to stay safe.
Yeah, 20, 30%. I mean, that's a big number, but you know what? That's not far fetched because I know there's gonna be that need for it. In the past, I'm curious, Josh, like when it comes to training, just in general, this is my first, real big pandemic that's impacted me. But are these individuals, these cleaners, were they trained on how to deal with the pandemic right now? If they're still working the day before, and if not, will they be specially trained down the road or after all this?
Yeah. The good news is that the industry has very specific standard operating practices pre-COVID and post-COVID. So we have a very much a training regimen where the individuals know what to do when they get on the site. They know what equipment to use, what supplies to use, and how to actually perform the job. With COVID coming in, we've had to leverage infectious disease specialists. We've relied on CDC and CDC guidance. The World Health Organization, OSHA has put out some standards. And also the chemicals, the companies that are putting in the supplies into the market, again, that are going to disinfect and fight the virus, they provide guidance as well. So what we do is we evolve those standard operating practices, and we do it immediately, the minute that guidance comes out, and we ensure that that training is done. So the individuals are not going to be put on the front line fighting this unless they are well trained and well prepared. But again, it goes back to the need. We have to make sure they have the supplies, that the people are engaged, they are trained. It's not as simple as saying, oh, don't worry about it, we'll go find some people to fulfill the demand. No, it takes time to train them, to make sure we get the supplies to them. And it's not as simple as snapping your finger in 24 hours notice, all of a sudden you have a clean building. We have to make sure they're protected. And yes, they're trained, but again, of evolving practices that all adhere to guidance from, greater organizations that are out there.
And not to say they were not respected or are not respected, but there may be a switch in how people view these professional cleaners down the road. I mean, they are an essential piece of how we live day in and day out and how we stay safe.
It's funny you say that. Is absolutely true. And forgotten is another word that we often would use. Unsung hero, silent in this whole fight. But man, can you think of anything more critical?
Yeah.
Than someone out there that is cleaning, fighting this outside of hospitals, right? We're in every single facility, every building that exists across San Francisco, across Oakland, anywhere. We are in every building. I mean, there is not an end segment. We're in restaurants, we're in grocery stores, we're in office buildings, obviously, arenas, theaters. It doesn't matter. And so, I mean, can you imagine a more important thing than having someone who knows what they're doing, walk in there and clean, everything appropriately to fight the virus? They've been forgotten for so long, and it's such a shame, but they're not going to be forgotten coming here in the future.
Yeah, and they're going to be protected. Anything else you want to get across before we say goodbye to you, Josh, here?
I think, Mike, just three things, if I could ask of your viewers and listeners. One is, if you see a cleaner, it'd be great if you thanked them. I think that's really important to make sure that they know that they're not forgotten, that they are appreciated. I think morale is of as much importance as anything else. So I think thanking them would be fantastic. Number two is, if we as individuals can adhere to the guidelines being put out by the CDC and others, so that we are following social distancing guidelines, that we are using masks when we need to, that also protects the cleaners. That protects each other, but that protects the cleaners as well. We want to make sure that we do our part, for sure. And then I'd say number three is spread the word. If you can spread the word about the importance of cleaners, I think one thing we've noticed in the first initial classifications of an essential worker coming from the federal government and coming from the local governments, it's not always first and foremost on the list. And when you think about it again, it is the gatekeeper to opening up all other essential workers in all other buildings. So just spread the word about the importance. Those three things would be great.
All valid points. I appreciate that, Josh. And you're right. Just saying thank you goes a long way. It can carry one worker throughout the day, if not throughout the week. So, Josh Feinberg, Chief Strategy Officer of ABM Industries and President of the Cleaning Coalition of America. Good conversation. I appreciate your time. Stay safe.
Thanks, Mike. You too.
Okay, will do.